Hey guys, welcome. It's Chris for Aftercare. Today we're going to be talking about an amazing product as well as going over a little bit of a demo on how I'm going to use the product. And this product that I'm talking about is Rejuran. Now, I'm sure you've probably heard of this before if you're tuning into this channel, but Rejuran is an amazing product line. They have a plethora of treatments that are available. So if you're considering trying Rejuran, there's a bunch of different options for you to check out that will help with whatever skin needs you're looking to boost. So this is a wildly popular skin booster, not just in Korea, but throughout the world. And Rejuran is based on Pdrn technology, derived from Salmon DNA, essentially. So Pdrn is polynucleotide. I like to think of as like the mother of the cell or of the DNA. Pdrn is going to give you a multitude of benefits as well as Pdrn, but one of the main takeaways or main differences of Pdrn versus Pdrn is that Pdrn has a longer DNA chain, which is going to correlate to longer lasting and quicker acting results within your skin. So you're going to see results much quicker, and it's going to last a lot longer than your traditional Pdrn types of skin boosters. Back to the topic at hand, we are going to be talking about Rejuran today. We are going to be doing a little bit of a demonstration using this product. This product, since it has Pdrn technology, it's going to be great for anti-aging. It's going to be good as a great skin booster to boost the hydration in your skin. It's also going to help boost collagen deep within the skin. So essentially you're getting some anti-aging benefits from the inside out. And since it's Pdrn, it's gonna last a lot longer than your Pdrn. So that's also another amazing thing. One really cool thing that I had found out is that Rejuran and Pdrn products, they actually help to repair the skin barrier. So if you've gone a little overboard with exfoliation, chemical peels, anything of that nature, and your skin is starting to be sensitized, you've damaged your skin barrier, and that's why your skin is feeling more sensitive. So this product helps to repair that skin barrier function, so it's going to be a great healer to the skin. There's going to also be a slight brightening effect, so this is really going to hit a lot of marks for your anti-aging skincare routine. So it's definitely one that is worth checking out. That's what we'll be using today. I will show you what this looks like. It comes in a nice sealed package. We have some beautiful packaging and boxing in here. So inside your kit, you will have 2 syringes. So these are 2 2 ml syringes, and essentially you would use one treatment and then you'll do another treatment about 2 to 4 weeks later, depending on what your skincare routine is. Now, before we jump into demonstration, I'm going to end up using this 5-pin crystal attachment, and I'm gonna be using that through my forehead area here. And the reason I'm only doing it on my forehead area here with this attachment is because my skin is a lot thinner here and it's a little bit more shallow, so I don't really need to do as deep. And this goes about 2 millimeters, which is perfect because your traditional meso techniques can be anywhere from 2 to 4 millimeters. For this is only going 2 millimeters, and that's about as deep as I need to go on my forehead. Since these needles will dull throughout the treatment because it's a fine tip needle, I also have my 4 millimeter meso attachment, which I will then attach to my needle, and I will treat this area through here using this 4 millimeter meso attachment. We need to clean our skin. Then we'll be using these are just some alcohol wipes. So 70% isopropyl alcohol is what I will be disinfecting my skin with prior to my treatment. And then I will have my gloves, and then I will have my product, and then we'll get started with the fun. All right, and now we're back. I'm just gonna go ahead and I'm gonna open my pack. So again, you have 2 2 ml syringes. Your treatment, typically you would wanna do 3 to 5 of these treatments within a 2 to 4 week interval, and then you would repeat this every like 9 months or so. As we know, you can do skin boosters so frequently. If you wanna do it sooner, you could. If you didn't want to do that many treatments, you don't have to. You should see some results after at least 2 treatments. So I'm gonna use 1 treatment, and then in about 3 or 4 weeks, I'm gonna do another treatment. And that's just how I do because I do lots of skin boosting treatments. So I'm getting a lot of the benefits. And since I'll be using my 5-pin crystal 2mm attachment, inside your package, you will also have 2 4mm meso needle attachments that you would attach right to this. So I'm just gonna go and open my 5-pin crystal attachment. This does have a little cap on it just for sanitary reasons. I'm going to break the seal off of this treatment, and you just have to twist it and break it off. I'm going to attach my 5-pin crystal pin, and this just has a lure lock system, so it just goes on and you just twist to make sure it is attached. Easy, done. All right, we have our gloves for sanitation. 70% isopropyl alcohol just to disinfect our skin. Now, if you are someone that's sensitive or averse to pain, you can numb your skin prior to your procedure. We are ready to just go ahead and get started with our treatment. So I'm just gonna remove the cap, and as you can see, you just have these 5 little tiny needles. Now with this, I'm just gonna be going into the skin, and I'm gonna be injecting a very tiny amount. Now, when you do enter the skin, you actually will feel the product. For me, it's not exactly precise. If you do wanna get precise, and if you're able to be precise with your treatment, you should be injecting approximately 0.1 to 0.2 mils into each injection site, and it should be spaced about 1 centimeter apart from one another, if you want to be technical. If you get a little bit of product loss, it's okay. You have a lot of product. All right, so I've treated my entire forehead. As you will see, we have halfway. So here's our halfway point. You can see this. So we've started here, now we're here. So we've essentially used 1 mil throughout this whole forehead and part of my temporal region. So now I'm going to switch out my needle into my 4mm meso attachment, and then I'm going to treat just this under eye area, just basically where I have my exposed skin. And again, it's a lure lock system, so you just twist this off, put this back on, twist, make sure it's secure, and it's ready to go. And as you can see here, we have just a tiny, tiny needle, very tiny, 4mm. All right, and that's it. We've used our entire 2 mils. So if this alarms you, don't be afraid. You are jabbing needles into your skin. You are going to have blood. If you take blood thinners, if you take ibuprofen, anything like that, you will be at more risk of bruising, but also more bleeding. But that's not a concern. So we will just go ahead and wipe. Now, a perfect thing that you could do at this point would be to do a sheet mask once you've wiped down your skin. As you can see, let me zoom in a little bit. Essentially, what you should have are little tiny bumps underneath of the skin. So essentially, you should have bumpy or braille-like skin because the product is sitting very, very close to the surface of your skin. So it's just a very subdermal injection. And that is just sitting there, and your body's going to your skin is gonna slowly absorb it, and it's gonna spread out, and it's gonna even out, and everything's gonna be good. So the fact that you feel lumps are a good thing, and it's nothing to be alarmed about because 1, this is not a filler. So it's not gonna cause vascular occlusion, it's not going to be a bump there forever. It will go away, rest assured. Typically for me, when I'm doing mesotherapy, depending on the consistency of the product, sometimes it might take 6 to 8 hours to, completely flatten out. In some cases, some products that I've used before, it has taken about 24 hours for those bumps to kind of subside. But again, it's nothing to be alarmed about. It does go down and it does go away. The fact that it's still sitting there and doing its job means it's actually working overtime. So that's a really good thing. But the quicker that the bumps go away means the more dehydrated your skin is. So if that's the case, then you need to amp up your hydration because typically meso bumps should stick around for a little bit of time. The more hydrated your skin is, the longer it's gonna take for those bumps to kind of go away. That's all I got for you as far as this treatment is concerned, but I will do a check-in tomorrow morning, just so you guys can see that the bumps have, gone down, everything subsided. Stay tuned and I'll be checking in shortly. All right, and here we are. It's the next day just for a check-in. So here's a little up close. As you can see, lumps, meso bumps are gone. Forehead. Just a little pinpoint bruising. That's typically normal with me and my skin. But yes, as you can see, the bumps have subsided. So yeah, never be concerned about that when you're doing mesotherapy. You're always gonna have those meso bumps or braille skin, but it's all just temporary. And actually last night before I went to bed, they were just about all gone. So yeah, that's my check-in for you guys. If you like this video, go ahead and give it a thumbs up and go ahead and subscribe. Head over to my channel at youtube.com/ChristopherMcGrady to see more content like this and to see a full video of what we just did today. So until next time, you guys stay healthy and be well. Bye.